one of the biggest lessons is that when you're doing something innovative and new that has never been done before, psychedelic-assisted therapy through the FDA, you have to be constantly proactive and educating both the FDA, the regulators, the doctors, the therapists, and the general public. And that the mistake that Lykos made was that they said, oh, traditional pharma companies have what they call a quiet period. When you have a quiet period for a drug that nobody's ever heard of, that's just a drug, maybe that works. But when you have a quiet period for a drug that is, 22 million Americans have used ecstasy or MDMA, one of the most popular recreational drugs in the entire world. And there are people that are concerned that it not become a medicine, all different kinds. So when you have critics and an extremely popular drug, and you decide not to respond to the critics because you have a, quote, a quiet period, you're losing control of the narrative. And that's really what happened. So that's one of the reasons, why I was so glad to do this podcast, because what we really need to do is go back and really educate people again and change the narrative from, oh, this was a terrible drug and the FDA was right to reject it and there's terrible science and, all these people are hurt and, if there's anybody that's benefited, it's probably not true and all these accusations. So this idea that this constant need to really lead and educate is something that I think is one of the main things I've learned.